Hi, my name is Dr. Ilya Skolnikov, and I'm the clinic director at Triad of Health Back Pain Clinic. Today we're going to talk about back pain. So, have you ever wondered what was causing your back pain? And by the way, there's different kinds of back pain, right? I mean, you could have back pain in the upper part of your back. You could have it anywhere. You could have it in your shoulders. You could have it in the upper part of your back. You could have it in the middle part of your back, or you could have it in the lower part of your back. But hey, maybe nobody ever explained to you that there's a specific cause of your back pain. Yeah, it's true. You might have hurt yourself bending something, bending down to pick something up the wrong way, or like most people do, especially if you twist and then bend down and you don't bend your knees enough, that could hurt your back, right? So everybody knows that. You might have a disc problem. You might have a sequestered disc. There's all these different, possibilities for back pain, right? So I personally have had really bad back pain, and it didn't go away at all for a long time. But the thing was that nobody told me what was causing my back pain. So I tried using low light level laser therapy, low level light laser therapy. I used different kinds of like tiger balm type things, like a mint preparation to help with the pain. I just kind of rub it on here. My pain was between my shoulder blades. That's where I was having the back pain. And then I also tried some other things. Trying to think what are the other things I did. Well, like acupuncture, right? And chiropractic. As it turns out, in our office now, we're able to help with any kind of back pain you can imagine. I mean, we've never had any single person that we haven't been able to help with their back pain. There was one lady who had really severe arthritis in her hip, and she ended up getting a hip replacement. As it turns out, she wouldn't change her diet, and that was contributing to the trouble with her hip. We may have been able to help her, but she wasn't willing to make the lifestyle changes. And anyway, she had really severe arthritis in that hip, and she ended up needing to get a hip replacement. So there's a number of reasons why we weren't able to, succeed with getting rid of her hip pain. This wasn't back pain, it was hip pain. But at any rate, so we can help you, and the reason why we can help is because we have the skills, we have the training to help get rid of low back pain, to help get rid of mid-back pain, and to help get rid of upper back pain. Did you know that the upper trap muscles, the upper trapezius muscles, are related to a specific organ and a specific gland, and that those specific organs and glands are related to specific nutrients? And if you combine all these different interrelationships together, you have a whole science called professional applied kinesiology. And that's what I am. I'm a diplomate of the International Board of Applied Kinesiology. So we can really hone in and kind of get a laser sharp diagnosis for you to understand exactly what caused your back pain, and then how to get rid of that sucker. Just boom, just blast it away so that you don't have the back pain anymore. I cannot tell you how many times to be honest with you, I'm a little frustrated myself, because I can't tell you how many times I've had patients come in who had severe low back pain, and we were able to diagnose exactly what was causing their low back pain. And then they didn't even want to get started with care. It's not funny. It's just like, oh. It's so easy to help a person with low back pain most of the time, because the low back pain is mostly related to a toxic colon. Sometimes people smoke for a number of years and then they quit smoking and they have a toxic colon, and now they're not able to detoxify their colon, and nobody even diagnosed that they had a toxic colon. And so now they have low back pain. It could be on the right, it could be on the left, it could be in the middle, it could be all three, it could be just a combination of the three, right? So the other thing is sometimes they hurt themselves doing something where they got under a great deal of stress, maybe a car accident, and then after the car accident they didn't heal right away because they weren't able to metabolize the nutrients necessary to decrease the pain and inflammation in their body. So while they thought that the main cause of their pain was from the injury, which makes sense. You would think that if the pain happened after the injury, that was the thing that caused it. But people should heal from these kinds of injuries if there's not a fracture or a major, avulsed tendon or something, or there's no, torn muscles. They should get better in about 6 weeks, 7 weeks, maybe 8 weeks tops. Really severe injury, maybe 9 weeks. But the medical research shows that people will get better after about 6, 7, 8, 9 weeks. So if you had one of these types of injuries and there was no fracture and there was no avulsed tendon, there was no torn muscle, and there's no sequestered disc, there's no disc pathology, meaning you don't have a, you don't have what I just said, the sequestered disc, you don't have a swollen disc, then you don't have a herniated disc, if you don't have that, you should have gotten better within 6, 7, 8, and 9 weeks, okay? 6, 7, 8, or 9 weeks. Sometimes I talk fast when I'm really excited. So if you didn't, somebody's missing what's going on with you. We can help you in our office. We can help you. Because we can diagnose what's causing you not to heal. That kind of a person who doesn't heal from that kind of an injury, typically, not necessarily you, but typically there'll be somebody who has trouble with their digestion, trouble with their stomach. Because it's in the stomach where 80% of digestion takes place, and it's in the stomach where you especially break down minerals and protein. And it's the minerals and protein, along with the fats, that are needed to build up new tissue and really heal from that type of an injury. So, again, these things are sciences that are tried and true. This isn't like some theory or something. We don't just guess with people's health here. We don't just try out a few nutrients, herbs, medications, and chiropractic adjustments, and emotional therapies, and naturopathic therapies, and osteopathic therapies, and traditional Chinese medicine, acupuncture, meridian balancing, just see what happens. No, we're getting a laser sharp diagnosis. We're like, boom. We're just honing in on the target. We shoot with a laser rifle, and we get a bullseye, and we get the right diagnosis. We provide the right therapy, okay, and we get the right result. We get the right healing response. It's like a magical thing, okay? I mean, literally. So we can have that happen for you. Most of our patients who have back pain, I mean, if they're not better in 3 or 4 visits, then hey, something's not right, okay? And it might be the lifestyle changes that we suggest that they have a challenge with at first, but everybody goes at their own pace, We can go from the symptoms you're experiencing now to feeling great with no pain, no back pain whatsoever, at whatever pace you want. We can go really, really, really fast, or we can go, at a medium speed or whatever you're comfortable with. So, again, my name is Dr. Ilya Skolnikov, and I've really enjoyed bringing you this information from Try to Health Back Pain Clinic, and we look forward to helping you with your back pain. There's information below. You might have to fill in your name and your email, and then we're going to figure out how to help you. Thank you.